glasses, contacts, that puff of air. Has anything ever changed in eye care? The answer is yes, absolutely. Let me tell you the biggest advancements I've seen in the dry eye space, and it's going to blow your mind. So the past few years have been amazing for the dry eye space. 10 years ago when I started, we had artificial tears and one medication. Well, in 2021, the FDA approved intense pulse light therapy, or IPL. A little later that fall, we had a nasal spray for dry eye. This past year, we have 2 new drugs that have come out, and they're amazing. They're helping patients have better vision, more comfortable eyesight. So let's go over what's new. Intense pulse light therapy is, in my mind, the biggest game changer in eye care. It's a light-based, natural therapy that reduces inflammation, gets rid of abnormal blood vessels, and it kills bacteria and parasites that live on your lids and lashes. In my opinion, it's the single biggest advancements in dry eye therapy, and it's FDA approved. I'll leave a link in the description below with another video specifically about IPL. The next thing is Tyrvaya. Tyrvaya is a nasal spray that helps you produce more tears. Now, why is a nasal spray a good thing? Well, remember, all those pharmaceutical options, all the drops that we have out there now have preservatives. When you put preservatives on your eye, that's going to cause it to be more dry and irritated. A nasal spray is a great option for patients that are on glaucoma medications or other prescription eye drops that are already irritating the eyes. A nasal spray is a great option to give you relief and help you produce more tears. My contact lens patients love Tyrvaya because they don't have to worry about taking their contact lenses in and out to get the treatment. One spray in the morning, one spray in the afternoon in each nostril, and you're going to produce more tears that gives you lasting comfort throughout the day. After that, we have Meibo. Meibo is the first drop that actually treats evaporative dry eye. Now, dry eye is either aqueous, means you don't produce enough tears, or evaporative, meaning they evaporate too quickly. Well, 85 to 90% of dry eye is evaporative. Up to this point, 100% of the drops were treating the aqueous deficiency. Why was there a gap in this? I don't know, but now we have an option that actually treats the evaporative dry eye. Not only that, this drop is shown to work in as little as 14 to 16 days. Again, you're going to get more relief the longer you use it, but it's a quick turnaround time, so you get a lot of benefit with a little effort. That's what I love about Meibo. And the last new advancement that I'm going to talk about today is Xdemvy. We've talked a lot about blepharitis, specifically Demodex blepharitis. Demodex blepharitis is where a parasite, yes, a parasite, is living in your eyelashes. I see this more often than you think. If you ever feel like you want to scratch your lashes, like fingernails across the lines, get checked out for Demodex blepharitis. Up to this point, we had some over-the-counter options that were moderately effective at treating it. Demodex blepharitis now can be eradicated in as little as 6 weeks, and that drop, after you use it, will have a lasting effect for 6 months to a year. How awesome is that? You don't have to do warm compresses and lid scrubs every single night. Now again, I recommend that you do, but a drop that you use for 6 weeks that will give you a lasting relief is one that I am very excited to use with my patients. So there's 4 new things in eye care that are affecting patients. My patients are seeing a huge benefit in every single treatment. If you have dryness, irritation, make sure you give us a call. We're going to help you out. These are things that are available to all eye doctors. Make sure your doctor is utilizing the latest, greatest, newest technologies, because I know I am. Hit that like button and subscribe, and we'll see you in the next video.